Have you ever wondered why the United States of America, a nation known for its wealth, power, and opportunities, finds itself in the grip of a relentless drug crisis? One that is claiming lives faster than we can comprehend, and leaving scars that run deeper than we dare to imagine. Now, cast your thoughts to Kensington Avenue in Philadelphia, a place where the drug crisis has escalated to terrifying heights. A place where the specter of a veterinary tranquilizer called xylazine, or as it's chillingly known on the streets, the zombie drug, looms large. A voice from the heart of Kensington echoes, "Over 90% of drug samples tested here in 2021 contain xylazine." People lie passed out on the pavement, their bodies marred by scabbing or oozing flesh wounds from xylazine. It's a sight that haunts you, a sight you can't forget. And yet, another voice chimes in. The wounds from xylazine, they lead to serious infections, sometimes requiring amputations. The drug sends users into a trance, leaves them unconscious for extended periods, and the worst part, standard overdose reversal drugs are ineffective against it. Kensington's struggle is not an isolated incident but a reflection of a nationwide crisis. Over 200,000 Americans have lost their lives to synthetic opioids like fentanyl since 2020. And in Pennsylvania, the grim reality is that one user dies of a drug overdose about every 2 hours, with nearly 80% of these deaths involving fentanyl. A voice from within the healthcare system laments, "The lack of awareness and education about xylazine among healthcare providers, especially in rural areas, is a significant challenge. People affected by xylazine use often suffer from severe wounds that require specialized care. We need to prioritize and improve care for these individuals." Now, as we reflect on the harrowing reality of Kensington and the drug crisis in America, the call to action could not be clearer. It's time to support initiatives that aim to combat the drug crisis. It's time to lend a hand to those who are on the front lines, fighting to reclaim lives from the clutches of drugs. The crisis in Kensington serves as a stark reminder that the drug crisis is not a distant problem, but one that is very present, very real, and very urgent. It's time to take a stand against the drug crisis, to support those who are fighting it, and to work towards a future where stories like Kensington's are a thing of the past.